Hello everyone, this is Dr. Shushma Sarila, consultant homeopath at Fidicus Homeopathy. Today we are going to discuss about a topic called as eczema, or in medical language dermatitis. So why are we discussing about eczema? The reason is the prevalency rate. It is prevalent in infants, it is prevalent in children, and also it is prevalent in the adults as well. And not only that, the work-life balance that it disrupts, and also emotional or the psychological distress that happens along with the disease is the reason for discussion. So let's dive into the topic to know more about eczema. What exactly is this eczema? Eczema is nothing but a group of condition. So there are different types of eczema. So it is considered as a group of condition which has inflamed skin. What do you mean by inflamed skin? Is that the skin is red in color, and also it is hot to touch, it is tender, or it is painful when you're touching it. And not only that, there are some blister formations, and sometimes there is very dry, dark, leathery skin. As you can see in the picture, this redness along with the heat which you can feel while touching it is called inflammation. So eczema is a group of condition which cause inflamed skin along with dryness, darkness, and also pain after scratching. And also it is associated with lot of itching. Now let's dive into the signs and symptoms of eczema. As we have already discussed in the definition of eczema itself, eczema means inflamed skin. What do you mean by inflamed skin? The skin in the starting stages is red in color, and when you touch it, it is hot, and also after scratching, it is painful or tender to touch. And not only that, it has severe type of itching associated with a lot of eczematous types. So as you can see here, there is red patches, and also you can see bleeding because of scratching, severe scratching. What else can you see? You can see redness, you can see dry skin. That is a characteristic feature of eczema. So how do you differentiate eczema from other diseases? The skin is very dry, and not only dry, it will become darker in color, it will have hyperpigmentation, and also the texture of the skin is very leathery, in the sense it's desiccated and dry, and also it will have cracks on the skin. And not only that, it will have, because of scratching, because of severe scratching, you can see minor bleeding all over the area where it is being affected. So what are the symptoms? Dry cracked skin, redness, itching, rashes. Sometimes, because if you scratch too much, it can cause weeping. That means there is a serous fluid oozing from the skin. It's called weeping. Then bleeding. We have sores, darkening, and then leathery appearance of the skin. These are the signs and symptoms of eczema. Now let's dive into the investigation part. As I told you, eczema refers to dry, inflamed skin. So whenever we are talking about inflammation, that means we are talking about some chemical reaction happening in the body. So whenever there is chemical reaction happening in the body, it might be because of an allergen. So whenever you're dealing with allergen, what are the common tests? Eosinophil test, which is where there is rise in the eosinophils, and IgE, immunoglobulin E test, which is associated with this allergic reactions. It might be eczema, it might be sinusitis, it might be allergic rhinitis, any of the things which are related to allergy, then there will be rise in eosinophils and also IgE. So here in blood test, we will deal with eosinophil count, IgE antibody test, and not only that, we will have specific IgE test where there is rise in IgE level to the specific kind of allergen. These are the blood tests. Coming to that, if the person is, or if the doctor is not able to diagnose it, then they will send it for a skin biopsy where the part of the eczematous tissue is taken and it is viewed under the microscope for better understanding. And not only that, there are allergy skin tests which are performed under the doctor supervision, which are called as prick skin test and patch test. So what is this prick skin test? See, the allergen, whatever the person is affected with, is put on the skin. It can be here, or usually it is done on the back side. A drop of the allergen is put, and the doctor will take a needle and prick the skin. And then we will wait for 15 to 20 minutes for the allergy to appear. So whichever allergen is causing an inflammation or redness, wheal around the allergen area, then that means the person is allergic to that. That is prick skin test. And what is patch test? The part of which the person is feeling allergic to, it can be pollen, it can be dust, anything that is placed on the skin of the person, especially on the back side, and then we will wait for 15 minutes to see if there is any reaction to that allergen. And whichever allergen causes reaction, that means he is allergic to it and he should avoid these triggers for eczema to not appear or not reoccur. And then buccal swabs. Because we have gone through the corona phase, everybody knows about nasal swabs where the nasal mucosa is tested. But here in this eczematous type, we will do a buccal swab where you will be taking, as you can see, a swab, and then they will swipe through the buccal cavity, and then it is tested for filaggrin gene mutation, which is very important for the causation of eczema. Here you can see the allergy reaction to the specific allergens, which is caused by skin prick test or patch test. Now let's dive into the structure and function of the skin to know the physiology, and then we will talk about the body changes so that we will know what is the physiology part and what has gone wrong in the pathology part or in the body changes part. As you can see here, you know that the skin is divided into three parts, which is the epidermis, the dermis, and the hypodermis or the subcutaneous layer. Remember that epidermis has another 5 layers. As you can see in the picture, these are the layers of the epidermis. So we will not be discussing about all these layers in detail, but we will be discussing about this layer called as stratum corneum. Remember that the upper layer is mainly because of the dead keratinocytes, and also all the keratinocytes are morphologically similar to each other. And also this dead layer or this old layer is the reason that we are being protected from the external environment. That means this layer or this stacked up dead layer or the old layer helps so that no microbiome or no bacteria will get inside your skin. So whenever there is a problem in the stratum corneum, remember that if there is any disruption, if it is breaking, and that means the microbe will start entering inside. So this stratum corneum is the one that will protect the skin from the outermost environment. Now let's dive into the causes and risk factors of eczema. The primary cause is genetic factors where there is filaggrin gene mutation. So what is this filaggrin gene mutation? Remember, as I already told you in the structure and function part, that there is stratum corneum or the outer layer of the epidermis or the old layer of the epidermis. Remember that the skin has this filaggrin gene which helps water holding capacity of the skin. That means your skin will be able to hold water, and also if there is any sort of problem in the skin, this gene will help in repairing it faster. When the skin is not able to hold water, then this eczematous part or the eczema starts appearing. So we'll learn about that in the body changes part. Remember that the causes are filaggrin gene mutation, primary one. Secondary is environmental factors. Many people are allergic to irritants, like it can be dyes, chemical dyes that you're putting on your hair, it can be detergents, it can be soaps, it can be certain kinds of fabrics, or it can be climatic changes. Remember that we are staying in an air conditioned environment or air conditioned workspace these days. Even air conditioning can also trigger eczema and also can maintain it. And also fuels, chemical and air pollution that we are being surrounded by. Lifestyle disorders. Yes, stress is also a maintaining and a causation factor for eczema. And hormonal disruption. Any hormone disruption, and many people during pregnancy face eczema because of the hormones being up and down. And also certain medications like lipid controlling statins and also immunomodulators can trigger eczema. Family history. If your mother or father or your primary sibling is suffering from eczema, there are chances or risk that you will also suffer from eczema. Now coming into the body changes part or the pathological part, how the disease is developed which leads into eczema. So now let's know in detail how this body changes go on which lead into eczema. As you can see that this part is the epidermis. So we have done a cross section of the epidermis, and here this part is the stratum corneum. As I already told you that filaggrin gene is responsible for cell maturation. So what do you mean by cell maturation? That means the newer cells which are formed, which are matured, are pushed up or stacked up. Okay, so everything that is stacked up, every keratinocytes, all these cells represent keratinocytes, or they are called keratinocytes. Every keratinocyte has a particular shape for itself. But if there is filaggrin gene mutation or if there are any genetic factors included, That means that whenever the cell is maturing, it's not properly maturing, and also it will lose its shape. So there is dysmorphic keratinocytes. So they are not proper in nature. The shape is altered, and not only that, filaggrin gene is responsible for holding the water. That means it is responsible for a character where your skin holds water. That means it does not allow water to evaporate. But because there is mutation in the gene, that is filaggrin, the water holding capacity is decreased. So what happens when there is water decreased in your skin? It becomes very dry, and not only dry, there is dysmorphic keratinocytes. That means shape and every structure, maturation, everything is altered. Whenever there is alteration here, filaggrin gene is responsible for repairing also, and because there is mutation in repairing also, there is problem in the stratum corneum part of the epidermis. So whenever there is problem, there is disruption. Because there is no water, the skin will start to crack, right? Because if there is water, the skin will stay together intact. There is no water, you are removing all the water from the topmost layer. So the skin will start to crack like this. It will form small microscopic cracks. Whenever there are cracks, what will happen? There is microbiome on the skin already because of the exposure to environment. So this microbiome will get inside, and there will be an allergic reaction created. So whenever there is allergic reaction created, you will have increased eosinophils and increased IgE, and it will cause inflammation. So what is inflammation? It will cause, because the allergen has entered, the body will send WBC to go and counteract for that allergen. Okay. So what is happening? You have WBC coming. You have increased eosinophils in the WBC, and you have increased IgE levels also. So what is the appearance of the skin? There is dryness, there is cracks, and because of the allergen entrance, you will start to have inflammation where there is allergic reaction in the body, and you will start itching because there is allergen already. And when you itch, remember, whenever you start itching with the hand, you will disrupt this layer. This whole layer will be disrupted. If you see in the microscopic level, you will see that you're eroding the layers of the skin while you're scratching. And more you scratch, blood will also come out, more allergen also will come in. So it is a maintained reaction. Okay. So because of there is mutation in the filaggrin gene, and also because of the genetic disposition, there is compromised skin barrier. Compromised skin barrier will cause allergen to come inside. It will cause inflammation. You will start to scratch, and there is more compromised skin barrier, more allergens coming. So this will maintain. So eczema is usually chronic in nature, but you can have acute eczema also. That is, whenever there is certain kind of allergen that you are very hypersensitive to, then it can cause flare up of that eczema. Now let's know what are the common sites for infants and for adults for eczema to occur. Remember, while we are telling common sites, it does not mean that it should occur only here, but these are the more susceptible areas. If you are taking infants, you can see that the scalp area and the forehead area, the mid part of the scalp or the vertex part, and also the forehead is more susceptible, and also the cheeks are also very susceptible. And not only that, the neck part and the collar part or collarbone part is very susceptible, and also this part is very susceptible for the infants. This part and back of the leg, as you can see here, back of the leg is also more susceptible parts for infant, and also the scalp part. If you're coming for the adults, then the more susceptible part is the neck and the collarbone region, and also inside near the folds, elbow fold, knee fold. So the folding part, wherever you're flexing it, wherever the body is folding, that part is very much prone for the adults. And also foot. Foot is also the most prone part for adults. As you can see, the inside of the elbows and near the knee, back side of the knee, wherever you're flexing your body, then that parts are more prone for elders. Now let's dive into the types of eczema so that you will have a better understanding. If you're suffering from eczema, what kind of eczema are you truly suffering from? So let's dive in. First one we are discussing is called as atopic dermatitis, which is most common type of eczema. So what are the causes of atopic dermatitis is that if you have a family history of hay fever or asthma, that means you have every chance, 50% high risk of suffering than normal individuals. So what are the cause? Family history of having asthma or hay fever, and not only that, if you have any allergic triggers or if you're having maintained stress, then this can also cause atopic dermatitis. But remember, if you're having a family history, it is a super added risk upon stress and also upon the environmental triggers. So let's know in detail what is the presentation of atopic dermatitis. Cause is family history, allergic triggers, and not only that, stress. So if you can see here, the skin is very dry, which is the classical feature of eczema. It is red in color or inflamed, which is another classical feature of eczema. So what you will see here in atopic dermatitis, it is usually the presentation is large. If you can see, it is not pertain to a small spot. The distribution is large, and not only that, it is dry in nature, it is desiccated, the skin is red, and also there is a lot of scratching which will cause bleeding. Okay, so what is the presentation here? In atopic dermatitis, you will see a lot of itching. So the primary presentation of every eczema is dryness. If you keep that aside, itching is more prominent in atopic dermatitis. If you have any allergen, then the skin will start itching, it will become dry, desiccated, and it will start to bleed. And also if you have stress also, it will come. If you have any genetic predisposition to hay fever or to asthma, your skin will tend to become red, dry, desiccated, main importantly itching. Next, coming into contact dermatitis. So this is the second most common type of dermatitis. So what happens is, if you're allergic to any sort of thing, like if you're allergic to hair dye, then you will start having reaction near your scalp area and also on the forehead area. If you're allergic to metal, some people are allergic to metal, so if they have a ring on the finger, then there is allergic reaction surrounding that part wherever it is covered. Okay, if you can see here, the person is allergic to metal, so there is a reaction along the place where the person has put the ring. Remember, atopic dermatitis, there is a lot of itching. Contact dermatitis, there is a lot of burning sensation here. So the person will experience wherever he has come in contact with the allergen. It can be even soaps also. If you're washing your hands and then you're feeling some burning kind of sensation, dryness, and little bit of itching, it is maybe because of contact dermatitis. Some people have allergies to soaps, especially soaps which are used for cleaning clothes, soaps which are used for cleaning utensils, and also detergents. Some people are very allergic to wool, and also some people are allergic to metal. Contact dermatitis, if you remove the trigger, usually it will subside, but the internal immune disturbance which is caused cannot be removed. It can only be removed through homeopathic medication. Now let's dive into the third part of eczema, third type of eczema, which is dyshydrotic eczema. As you can see in the picture, this is also the third most common part of eczema. If you can see the fingers and observe clearly, many people will be having small kind of blisters which are fluid filled or serous filled, especially in this area. So here we have given a bigger picture. As you can see, there are small bumps which are fluid filled, which are small blisters. So what is the causation for this dyshydrotic eczema? If your hands are very sweaty, so this is associated with dyshydrotic eczema. And not only that, even if your hands are sweaty, remember the sweaty hands will always represent a stress or anxiety in the person. So people who are having chronic anxiety issues or stress issues and who are having sweaty hands will have this dyshydrotic type of eczema, especially on the hands. And also people who are suffering from vitamin B complex deficiencies are a super added thing to this dyshydrotic eczema. Remember that here in this type of eczema, there is itchiness associated. In contact dermatitis, there is less itchiness and more of burning, whereas in atopic dermatitis, there is more of itchiness rather than burning. Here in dyshydrotic, there is a lot of itchiness. Next, coming into the fourth type of eczema, which is nummular eczema. If you can see this, it feels like a ringworm infection. So what are the main differences between a nummular eczema and a ringworm infection is that, remember, here there is redness, there is dryness, and it is equally spread. Okay, but in ringworm infection, if you take, there will be centrally, there will be clearing. Okay, so the central part is always cleared, and the edges are always very much inflamed or red in color. Okay, and the spreading is also outward. So the inside part, whenever if you see in a ringworm infection, is always clear. But if you see a nummular eczema, there is overall same pattern. There is no clearance anywhere. That is nummular eczema. That is how you differentiate between a nummular eczema and a ringworm infestation or a ringworm affection just through looking. Okay, so what are the causes of this nummular eczema? In people who are having genetic predisposition, even a small insect bite can cause this nummular kind of eczema. See, atopic dermatitis is very widespread, whereas nummular eczema, it is round in shape and also there are spots. Okay, so the spread is usually in the area where the insect has bitten you. Now the other kind of eczema, which is seborrheic dermatitis. So what's seborrheic dermatitis? It is eczema of the scalp, where because of certain irritations like dyes, it can be shampoos or it can be filaggrin gene mutation or genetic predisposition. There is redness, as you can see, not only on the scalp, there is redness and dryness on the forehead, on the mustache area. So remember, wherever there is hair on the face or on the scalp, this seborrheic dermatitis can be affected. Like for example, even this eyelid area also can show seborrheic dermatitis. How do you differentiate seborrheic dermatitis from dandruff? See, in seborrheic dermatitis, the skin or the part which is suffering from seborrheic dermatitis is very leathery in nature. Okay, whereas in dandruff, you do not see that leathery appearance. In seborrheic dermatitis, you can see hyperpigmentation in certain areas, but it is not found in dandruff. And also seborrheic dermatitis, if you are putting any sort of shampoos, anti-dandruff shampoos or any sort of anti-dandruff treatment, it will flare up, but it is the opposite in dandruff. Now, the next kind of dermatitis, which is stasis dermatitis. If the person is suffering from diabetes from a longer period of time or varicose veins, stasis dermatitis is most likely to appear. So what is stasis dermatitis is, the blood will start pooling in the lower part of the body, that is the lower limbs, and also there is no proper pulling up of the blood into the heart. So there is, if you can see here, the blood will start pooling down the ankle and there will be micro problem, that is micro disruption in the capillaries near the leg because of there is pooling. Okay, and that will release little bit of blood into the tissues, which will cause reaction, and that will cause stasis dermatitis. So stasis dermatitis is 99% found in the limbs itself, and also it is because of varicose veins or because of diabetes mellitus, which or because of genetic predisposition. But diabetes mellitus and as well as this varicose veins are the 90% causes of stasis dermatitis. What do you see here? You will see dry skin, you will see red skin, and also you will see scratching, and also you will see bleeding because of that scratching. So it is found in the lower limbs, and if it is left like this, that can lead into ulcer formation. So the prognosis of stasis dermatitis can lead into ulcer formation if it is not medically treated. Now let's get into the conventional treatment part. The first one is topical corticosteroids. Do you know that steroids are always applied so that the eczematous part does not spread to other parts of the skin, and also it does not address the issue or does not address the trigger part, but it is only helping so that this part will not or this eczematous part will not spread to another part of the body. And also by applying topical corticosteroids for a longer period of time, there is problem in the collagen production, which can lead into a bigger stretch mark, or it can lead into stretch marks formation. Next, moisturizers. These are just a precautionary method. And then even bathing practices like bathing in lukewarm water and not hot water or cold water. These are all just precautionary measures. Next, oral medications. Oral steroids or giving oral corticosteroids, it will help to not flare up the disease, but it will not act on the trigger of the disease. So it is not treating the cause of the disease, it is just maintaining, or it is helping so that the disease will not spread or flare up. Remember, if you are taking a lot of oral corticosteroids, it is not curing the disease first thing. Second thing, it is not addressing the cause. And the third thing, you will put on a lot of weight, and also associated kidney problems will arise if you're using oral corticosteroids for a longer period of time. Next, immunomodulatory therapies. If the cases are severe, the doctors will prescribe immunomodulatory therapies, but a longer term use of immunomodulatory therapies can cause skin cancer. Coming into the homeopathic treatment part of eczema, why should you choose homeopathy over the conventional methods of treatment? First and foremost, wherever there is conventional treatment, you will see that they're using a lot of steroids, which will have a lot of side effects. But in homeopathy, the medications that we give are having no sort of such effects or no side effects at all. So it is very safe to use. Second thing, we are not giving you any sort of steroids which will harm or have a problem in the future. So there is no steroid use. Next thing, we are addressing the cause of the disease or the trigger of the disease. So the treatment is given and the cure is inside out, and also the recurrences are very, very low. That means the chance after getting cured from eczema that you will have a recurrency in eczema, that recurrency rate is very low in homeopathy when compared to the conventional form of treatment. And also the medicines are palatable, and helps in preventing, it helps in curing, and also it helps in giving relief to the patient without harming the patient in a safe manner, curing the patient inside out, and increasing their immunization or increasing their immune status. So here we are addressing the issue, it is safe, we are increasing the immunity so that the next time you have an exposure to that allergen, you might not get the same flare up which you used to get. Now let's get into the precautionary part. First one, avoid irritants. If you're going through eczema, the first thing that you have to do is to avoid any sort of known allergens that you know. Avoid heat. A lot of heat will take out more water from your body, making it more dry and desiccated. So avoid heat. Avoid scratchy materials, like avoid any sort of fabric that you're putting on your body which will trigger that allergic reaction, like putting on a lot of wool. Wool can trigger eczema. Avoid chemicals, avoid allergens, and also avoid synthetic fabrics which are not natural in nature. Managing stress is an important part of eczema, as a maintained stress can cause or maintain eczema. And also getting enough of sleep. Enough of sleep means your hormones are working at their best and there is no disruption, leading into cure, or it can help in curing eczema. And also maintaining a healthy skin barrier. Remember that the skin needs fat. So having good amount of fat, not bad or trans cholesterol or trans fats, but having good fats will help you in repairing the skin. So consume foods that are high in omega-3 fatty acids like flax seeds, or you can consume fish. That will lead into increased omega-3 fatty acids in the body, which will help not only in relieving the pain but also in helping the barrier to be repaired and also not compromising on the skin barrier. And remember to use fragrant free products, as that can trigger allergy. Then what is the prognosis if the eczema is left to itself? First thing is worsening of the symptoms. So you might experience increased burning or increased itching, increased dryness, and also because of severe form of scratching, there will be bleeding, and after bleeding in certain section of people, it can lead into scarring. So scarring will be permanent, or the hyperpigmentation which is caused due to scarring will be permanent in nature. Coming to the consultation part here at Fidicus. Here at Fidicus, if you are suffering from eczema and you would like to get in touch with us, we have two types of options, online and offline. Here in online, we have audio consultation as well as video consultation. If you are staying far away from the nearest branch of Fidicus, you can get in touch with us either through online call, that is audio, or video call. If you have any sort of investigations, you can share it with us. After doctor consultation, we will be delivering you top rated high medicines to your home, that is door delivery. If you're staying here in India, it will take at least 3 to 4 days for the medicines to reach you. If you're staying in USA, it can take up to 3 to 5 business days to reach you, or anywhere apart, it can take 4 to 8 business days to reach you. If you're staying near the nearest branch, you can come and visit us in person. If you're suffering from eczema and you want to cure eczema, you can contact us through this given number, either through WhatsApp, call, or you can ping us in message. If you're suffering from eczema and you want to cure your eczema, then why should you opt for Fidicus Homeopathy? Here at Fidicus, it is highest chance of health, and we follow three important principles. First is the given highest success rate that we experience, and also the transparent treatment. We will be giving you or the notes of the progress of the disease, how your disease is, and we will be educating you on it. And not only that, the personal care here at Fidicus is top notch. If you want to choose homeopathy, try Fidicus Homeopathy. Thank you.
Fidicus Homeopathy.